Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, August 4th, and this is my daily briefing. We've had 283 cumulative positive cases in Missoula County to date. We got 27 new cases over the weekend and 3 new cases since yesterday. 279 of those were identified by testing and 4 were epi-linked. We've had 203 recoveries and 1 death. 3 Missoula County residents and 3 non-county residents are currently hospitalized in Missoula County, and we have 79 active COVID-19 cases with more than 368 close contacts. Active cases and their known contacts are in quarantine and isolation, and they'll continue to be monitored and supported as needed. The state of Montana is reporting 4,314 cumulative cases, which is up 82 from yesterday. There are now 1,484 active cases with 70 active hospitalizations across the state, and there have been 64 deaths related to COVID-19 in Montana. Today I'm going to talk about the process of testing for COVID-19 along with the various challenges such as supply shortages that can produce testing result delays, as well as follow up on some of the data that I shared last week. First, it's important to note that testing for COVID-19 requires a coordination of multiple organizations. The manufacturing of testing supplies is essential in conducting adequate widespread testing. Since the beginning of the COVID-19 pandemic, there's been a worldwide demand for testing supplies, resulting in shortages of the nasal swabs that are used for collecting specimens from the individuals seeking a test, as well as the necessary chemical agents used for testing the specimen at the lab, and finally the equipment and staffing capacity that's required for conducting COVID-19 tests. Within Missoula County, there are multiple providers who collect COVID-19 testing samples, including the Missoula City County Health Department. The health department is testing people who are showing symptoms of COVID-19 or people who have been identified as a close contact of someone who's tested positive for COVID-19. Once an individual schedules a COVID-19 testing appointment, they're invited out to our testing clinic where a nurse will use a special nasal swab to collect a sample from the nose. This increases our dependency on ample manufacturing of the swabs. Once the specimen is collected, the swab is stored in a tube with viral transport media, packaged appropriately for transfer, and then sent to a private or state lab for testing. Due to the increase in statewide testing, these labs are receiving a large number of specimens, increasing the amount of time that it takes to complete the tests and then send the providers the results. Labs must complete 2 crucial procedures in order to effectively assess a specimen. The first is an RNA extraction, where they isolate the viral RNA for further evaluation. Once this process is complete, the laboratory techs mix the viral RNA or mix specific chemicals with each sample before placing them into a machine for analysis. This process is called polymerase chain reaction, or PCR, and it identifies the sample as being positive or negative for COVID-19. The machines that conduct the PCR test can only hold a limited number of samples, and with increased testing, machine capacity also impacts the amount of time it takes to produce test results. Once the labs complete these procedures, they send the results to the providers who initially collected the specimens. Testing specimens for COVID-19 requires ample supplies, and because of the worldwide demand for testing supplies, labs across the nation have been experiencing supply shortages, which can also increase the amount of time that it takes for providers to receive those test results. Once a provider receives a test result, they communicate the results to the patient. If a patient tests positive for COVID-19, the provider is also required to report this information to the health department so that the health department can begin a case investigation. Positive results are also reported directly from the state public health, DPHHS, to local health departments to ensure that the case investigation can happen very quickly. If you are tested for COVID-19 and your results are delayed, please remember that only the provider who tested you can offer that information about your test results. We understand that these testing delays can be really frustrating, but it's important to understand that there are multiple elements that might impact the speed of the testing process. We know that some people are still waiting for results from a few weeks ago, and we apologize for that delay, and we're also really frustrated by it. The state lab has now changed their process for determining which samples get sent out to other labs, and we've actually been getting results back within a few days for about the past week and a half now. While we don't have control of all of the elements related to COVID-19, we do have control of a few. First and foremost, Please practice mitigating strategies by maintaining 6 feet of physical distancing, wearing a face covering if you're unable to maintain physical distancing, and washing your hands or using hand sanitizer frequently. If you're sick, please stay home. If you're identified as a close contact to a person with COVID-19, please follow the health department's instructions to quarantine. Finally, if you're showing any symptoms of COVID-19, please call our info line and schedule an appointment for a COVID-19 test at 406-258-INFO. The health department adopted a rapid testing system, and while these systems are still dependent on adequate supplies, we are hopeful that the system will help us decrease the testing delays that our community has been experiencing, and we hope to get that testing equipment up and running hopefully within the next week or so. Last week I spoke about the epidemiology that we're looking at in order to make decisions. We work with our partners at the University of Montana to update that data a couple of times a week so that we can inform our response as well as to keep you informed. We also share that data with the school superintendents in our county so that they're able to make good decisions regarding return to school this fall. We're currently seeing an increase in cases as well as an increase in the reproductive value, which, if you recall from my briefing last week, is the number of people that become infected after being exposed. In my briefing last week, the R value was 0.9, so it was just under one person. This week, the R value is at 1.04, so we're definitely seeing an increase there. We also track and post on our website a variety of other data, such as cases identified and plotted by symptom onset date, cases by age and gender, as well as whether they were a contact to a case, travel related, or if no known source of infection could be identified, and that would be considered community spread. So I would encourage you to take a look at that data. It's on at missoula.co/cvirus. There's a link on the right-hand side of the screen that says Missoula County Epidemiological Data. So if you click on there, you can see all of the data that we've been collecting. And we do update that regularly. So that's it for my briefing for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr, CINDYFARR. Click the notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can call 258-INFO if you would like to schedule a test or you have general questions about COVID-19. And check out our website at missoula.co/cvirus. And until tomorrow, everybody, stay healthy.